Good evening, everyone. Today we have with us Dr. Tarun Kumar, a senior nephrologist at the most reputed hospital, Sir Ganga Ram Hospital. He has extensive experience in all kidney-related problems, and this session is kept very open to make you aware of any kind of diseases or the queries that you have. So, over to Dr. Tarun Kumar. Thank you so much for giving us your time today, sir. We have our guests here. They have some questions that they would like to ask you. So we can begin with the queries, and I hope it's audible to everyone. We have Mr. Varun, Mr. Jaswinder, and I think there are other guests who will be joining us in another 5 to 10 minutes.
Okay, sure. Thank you so much for giving me this opportunity to speak with the patient who genuinely need my advice regarding kidneys and kidney health. So we may start the session.
Yes, sir. Um, Mr. Varun and Mr. Jaswinder, you can unmute yourselves and you can start with the questions. Anything that you would like to ask, we have Dr. Tarun here, and he's going to guide you.
Yes,
Now,
yes,
yes.
yes, Dr. Shabnam, good evening.
Good evening, Varunji.
Yes, I'm from Kathmandu, Nepal.
Okay, sir.
I have a problem of kidney since last 5 years.
Okay, what kind of problem you are having?
I have problem. Always my creatinine level is high, 1.5, 1.6.
Okay, and what else?
Other, sorry,
What else? What other symptoms you have? Any other
I
symptoms?
have I have no any other symptoms.
Okay, so why you got it checked 5 years back when you first got
I
to know
I,
that?
I check regularly every 3 6 months and go to
Okay,
ultrasound also.
okay,
And the ultrasound they told me that I have a renal parenchymal disease, bright
okay,
disease.
okay, sir.
That's my problem.
So let me ask, is there any hypertension, any issues
No,
with raised BP, any blood sugar, deranged blood sugar that you have?
I am a low blood pressure person.
Okay. And have you been
Since
taking any, okay, have you been taking any herbal medications, any Ayurvedic medications, any protein supplements, any painkillers that you remember of? Okay. So is there any history of any blood in urine, froth in urine?
yes, before 5 years before there is some problem to my urine,
Okay,
and I control this through by dieting and
okay,
some my habit change
okay.
and
So
is control. No,
okay. So, except that, have you faced any problem while passing urine? Is there any
no,
hesitancy that you have to apply some pressure while passing urine? Stream is not good, or you have to go for micturition again and again for passing urine? You have to go again and again to the washroom. Is there any
no, no.
problem like that?
This time no. There's no any problem. This only
Okay,
ultrasound. They told me that you have a great first, second. That is
okay,
prostate one problem.
okay,
Little bit problem because I am now 55 years.
okay. So
Uh,
I would like to see your ultrasound image and the report of your ultrasound plus your urine test and a urine routine and urine PC ratio. Maybe you can send them to me.
okay.
And uh,
This 1 week before I test my cystatin also because
mm,
always creatinine is high. There's a 1.52
mm, mm, mm.
microgram per liter.
Acha, the
That
protein
means
was high, 1.52 microgram per liter it was.
cystatin. Yes,
Acha, 16C you are saying.
yes, I am sure.
Okay. What I think it is a chronic interstitial nephritis. So it is a kind of a renal disorder in which the urine is maintained, but the filtration of the kidney is not that good. That's why the
Yes,
creatinine is slightly raised. To confirm it, we need to see your ultrasound report and your urine test. We want to see the routine urine plus the urine PC ratio, what amount of protein you are passing in urine,
no,
and
I told I just I 2 weeks before I check it, it's all this examination, all
Mhm.
are no. There is no protein in urine. There is no albumin in urine. There is no
Okay.
any sodium, potassium also very good.
So what was the
Protein
last BP? Last BP when you checked, what was it?
Yesterday, 70 by 110.
170 by 110.
No, no, only 110 by 70.
Acha,
Somewhere,
110 by
somewhere,
70 it was.
somewhere, yeah, somewhere till 70 by
So,
110 is left.
so just send me the report of your ultrasound. Just
Okay,
right now, send me the report of your ultrasound, है ना?
okay, I will just send you. I have on my hand this
Hmm.
ultrasound.
Hmm. And the
What
thing
is
is,
your what bride disease? I
Bright's
am don't
disease.
I don't
Hmm.
understand about it. They told me that you have bride disease, bride disease, bride disease since 4 years,
नहीं नहीं
5
नहीं,
years.
that's why I wanted to see the report of your urine, है ना? Actually it is a type of a glomerulonephritis. Sometimes
Yes.
what happens, it is the auto antibodies which act against your own organs like your kidney. So they may cause damage to the kidney, है ना? They may cause damage to the membrane of the kidney, which may lead to the leak of protein and blood in urine. So if you are persistently having microhematuria in urine, then it could be because of the Bright's disease, that is known as IgA nephropathy. So
All
that
right.
is the thing. So for to confirm it, and to confirm why you are having these complaint, we need certain set of investigations. ठीक है?
Okay.
So I will write those investigations for you and will send you the prescription. है ना? And after getting those investigations done, then you can follow up with me online only.
Okay. No,
है
no,
ना?
so after
So
1 week, I will after 1 week, 1 and 10
yeah,
days, I am
yeah,
coming
yeah.
Delhi.
Yeah, okay, okay. So you can come and meet me in Ganga Ram
Okay.
Hospital. Yeah, na,
Okay.
that
I'm
will be good.
okay, sir.
Definitely.
I'm
So
just
I will advise you to just call me once before coming here. है ना?
yes.
Just let me know. So I will share my number with you, है ना, and my PA's number with you. So just drop a message before coming here. So I know that you are coming, and if I'm available, if I'm not available, because till 21st I am out of city. है ना? So after 22nd I will be available. So it will be better if you visit at that time only.
After 26,
After 22nd of Feb.
2nd of February.
Yeah.
Okay. Because I'm coming after Shivaratri. Shivaratri is coming. So that's why I'm waiting for Shivaratri. Just like
Definitely. After 22nd Feb, you can visit me, and just before coming, you can drop a message and you can get all your investigations that you have got done so far, your ultrasound and everything. Just get all the reports and meet with me.
okay, sir. I will come here. I
Okay.
will come to see you. You just
Definitely.
your phone number?
हाँ तो they Indus Healers will share my number
Okay,
with
no.
you. है ना?
Thank you, sir.
That's not an
Okay.
issue. Okay. Oh,
Okay, sir. Thank you.
oh, take care.
Thank you, sir.
Thank you. Anji.
Can you listen
Yeah.
me?
Yes.
Yeah. I can listen you now. So in which language you are comfortable with? English or Hindi?
हिंदी।
ओके मैं डॉक्टर तरुण कुमार हूँ, है ना, सर गंगा राम हॉस्पिटल से नेफ्रोलॉजिस्ट। तो आप मुझे बताइए क्या आपको परेशानी हो रही है?
मेरा ये अभी 22 PA किया है नेपाल में,
हम्म।
काठमांडू।
हम्म।
और लूपस, SLE लूपस का बोला है, बाथरो रूमेटोलॉजी
ठीक है।
SLE लूपस का बायस निकला है।
तो
और
कितने दिन से आपको दिक्कत कब से हो रही थी? क्यों किया बायोप्सी? कब से? आज से कितने दिन पहले तक बिल्कुल ठीक थे? कब से सिम्टम्स चालू हुए?
4 जनवरी का मेरा वो स्वेलिंग होने लगा, वो
अच्छा,
पैरों में।
उससे पहले बिल्कुल ठीक थे आप?
हाँ, उससे पहले थोड़ा थोड़ा स्वेलिंग हो रहा था तो नेगलेक्ट किया 2-3 दिन।
ओके ओके
और
ओके।
एक मॉर्निंग में एकदम स्वेलिंग होने लगा,
ठीक है।
और पेशाब भी रुक रुक के थोड़ा थोड़ा आने लगा।
ठीक है।
और और उसके लिए टेस्ट वगैरह हुआ, और
हम्म।
डॉक्टर ने बोला कि इसको बायोप्सी करना पड़ेगा।
ठीक है।
और स्किन कल्चर सब सब पता लगा के, तो क्रिएटिन अभी अभी लास्ट टाइम का रिपोर्ट 2.10 है।
अच्छा। ठीक
पोटाशियम
है।
69,
ठीक है।
या यूरिया 69, पोटाशियम है। तो अभी थोड़ा थोड़ा पेशाब में वो झाग आता है ना, वो
हाँ
होगा।
हाँ हाँ हाँ।
और थोड़ा
नहीं, ये तो जो ल्यूपस की बीमारी है ना, वो तो
जी
ठीक हो सकती है ना?
जी।
तो उन्होंने भी समझाया होगा कि इसकी मेडिकेशन
हम्म।
चलती हैं, उससे हो सकता है डिजीज रेमिशन में जा सकती है ना?
जी।
तो इसमें तो ये भी पॉसिबल है कि क्रिएटिनिन भी रिकवर हो सकता है, पर उसके लिए ना एक बारी बायोप्सी की रिपोर्ट देखना जरूरी है। ठीक है।
आईएसपी का रिपोर्ट मैंने सेंड किया था इसमें व्हाट्सएप में।
अच्छा अच्छा अच्छा। ठीक है, तो ये जो बायोप्सी का रिपोर्ट है ये देख लेंगे। ठीक है। और
जी
उसके बाद फिर हमको ट्रीटमेंट जो है वो मॉडिफाई करना पड़ेगा, है ना। तो
जी
बेटर तो ये होगा, या तो फिर ऐसा करते हैं, आप बायोप्सी की रिपोर्ट भी भेजो, जो भी करंट
जी
इन्वेस्टिगेशंस है वो भी भेजो। ठीक है।
जी
तो इंडस
जी
हीलर्स हैं, वो मेरा नंबर
जी
आपको शेयर करेंगे। और फिर
जी
इधर अगर यहाँ पर विजिट कर सकते हो तो वेल एंड गुड है, गंगाराम हॉस्पिटल में। ठीक है। और अगर नहीं आ पाओगे तो फिर हम ऑनलाइन कंसल्टेशन करते हैं इसके बारे में।
जी ऑनलाइन, अभी तो ऑनलाइन ही कर पाएंगे।
अच्छा, ऑनलाइन ही कर पाएंगे ना, हाँ, तो ठीक है, ऑनलाइन कंसल्टेशन करते हैं, एटलीस्ट ट्रीटमेंट को स्टार्ट करते हैं। ठीक है ना, क्योंकि
तो
जो
अभी
ल्यूपस की बीमारी है वो तो कंप्लीट रेमिशन में जा सकती है, पूरे तरीके से ठीक भी हो सकती है।
जी,
ठीक
तो
है।
अभी जो मेडिकेशन दिया है वो मेडिकेशन
हाँ
1.5 महीने के लिए दिया है ये।
ठीक है। ठीक है। क्या दवाई चलाया है?
कोर्टिलोन चलाया है, माइक्रोफिट
हाँ।
चलाया है। और
ओके।
माइक्रोफिट 1 1 ग्राम सुबह और शाम। और
हम्म।
कोर्टिलोन 50 mg, 40 mg, 30 mg,
हाँ
इसको
हाँ
2 हफ्ता का
हाँ।
गैप में। और
ठीक है।
विटामिन चलाया है।
हम्म।
और एक ठो और मैं MCQN मैं चलाया
हम्म।
है, HICQN।
तो ठीक है फिर, अभी थोड़ी देर में आपको ना फोन नंबर शेयर करते हैं। ठीक
जी
है। तो
जी
उस पर फिर आप सारी इन्वेस्टिगेशंस वगैरह सब कुछ भेजो, है ना।
जी
और उसके बाद
जी
एक ऑनलाइन अपॉइंटमेंट बुक कर लेते हैं।
जी
ठीक है ना, तो उस पर फिर डिस्कस करते हैं फर्दर ट्रीटमेंट कैसे करना है, और
हम्म,
ट्रीटमेंट ठीक चल रहा है या नहीं, है उसमें कुछ चेंज करने की ज़रूरत है।
हम्म,
एक बारी देख लेंगे डिजीज का सिवियरिटी कितना है, इन्वेस्टिगेशंस में क्या है, फिर उसके हिसाब से आगे ट्रीटमेंट मॉडिफाई करेंगे।
ओके।
ठीक है ना। हाँ, तो अभी नंबर शेयर करते हैं थोड़ी देर में, है ना।
जी
हाँ जी। ओके। हाँ। सो वी वर डिस्कसिंग अबाउट द renal parenchymal disease and the associated problems with it. So I am Dr. Tarun. I am from Sir Ganga Ram Hospital, New Delhi. It controls the milieu of the body like BP, like heart rate and everything. So if the kidney is affected, then we can have wide range of symptoms, starting right from difficulty in passing urine, passing froth in urine, having blood in urine, to edema, starting from the feet, from face, and to the whole body, and then uncontrolled hypertension, and finally leading to vomiting and giddiness, headache, and other symptoms that we can have. So I received some queries regarding the same, and I will be addressing them one by one. So if you are diagnosed with bilateral renal parenchymal disease 1, how do you need to manage it? So first of all, it is important to know why there is a renal parenchymal disease. So usually, every patient is not expected to have chronic kidney disease. Only those patients who have uncontrolled symptoms and are being ignored for a long duration can develop it. So first thing, if you have any symptoms that I already told you, like any difficulty in passing urine, you are having swelling, uncontrolled hypertension, passing any blood or froth in urine, then you should get yourself evaluated immediately. If you are fine to have any disease which is associated with kidney, then you should consult a nephrologist at earliest as possible. So the things which is to be done are, if there is an edema, then the fluid should be restricted. If there is any shortness of breath, there is a shortness of breath on walking or lying down, then the fluid should be restricted. The intake of all the fluids, it should be restricted to less than 1 liter or 1.5 liter, depending on your urine output. If it is because of the excessive dehydration, you are having low BP, then you should take adequate amount of fluids. You should avoid any NSAIDs, any painkillers, over the counter medication, any homeopathic treatment. It should be avoided. What to eat and not to eat. So that depends upon the severity of the disease. If the disease is already CKD stage 3 or 5 and your kidneys are functioning less than 30 ml per hour, then it's better to avoid the food which is rich in potassium, like the green leafy vegetables, the citrus fruit, the banana, the coconut water. It should be avoided. If you are having any stones, then the food items which may lead to increase in stones like coffee, cocoa, chocolate, it should be avoided. Lifestyle changes, you should do regular exercise, try to shed some weight, take adequate amount of fluid, quit smoking. So it should be done. Then coming to the next question, they are asking that the creatinine is raised. What should be done next? Bashiaru from Nigeria. So if the creatinine is raised, then you should get the basic investigations done, like the urine examination. It should be done. You should look for the amount of blood or protein which is passing in urine, and along with that, a basic ultrasound should be done. And if there is any problem with that, then as earliest as possible, a nephrologist should be consulted. So H. Quadri, he is asking that he is having frequent urination all the time. So yeah, it could be because of the infection, a urinary tract infection, a urine routine to look for the amount of pus cells which are present in urine, and plus urine culture should be done. Okay, so we are having a guest here.
Hello.
Hello. Hanji.
Uh,
So I am Dr. Tarun
uh,
Kumar from Sir Ganga Ram Hospital. So in which language you are comfortable? Hindi or English?
English.
English. May I know your name?
My name is Aklilu from Ethiopia, Addis Ababa.
Okay, sir. So what kind of query you are having about kidney disease?
Yes, I sent already in WhatsApp. I don't know it's reachable to you or not.
Okay. So in a brief, if you can tell me.
Okay. 6 months ago, I made a biopsy, kidney biopsy in the India Fortis Hospital,
Okay.
and my disease is immune complex mediated MPGN.
Okay. MPGN you are having.
Yeah, at that time, my kidney is 75% is good, 25% already is curious or
Okay.
not working.
Okay.
The doctors prescribed me MMF and
Okay.
Prinsolo steroid, and
Mm-hmm.
I'm taking for 3 months, and it is working. I am in good condition.
Okay.
Suddenly, at the beginning of September, or I think at the end of August
Mm-hmm.
2025, suddenly my creatinine is increased. At
Okay.
that time, I have a flu type or a flu disease or cold like disease.
Oh,
The new case is only that time. At that time, the flu.
okay.
Maybe it is the reason, I don't know.
Mm-hmm.
Then the creatinine suddenly increased. The MMF is stopped working.
Okay.
Then the second option, they used cyclophosphamide injection.
Cyclophosphamide. Yes,
Yeah, I take it for 2 months, 2 doses,
definitely.
and also rituximab. Rituximab,
Okay.
two protocol. I take it also.
Okay.
All this medication is not working for me, and the high dose Prinsolo also.
Okay.
Methyl Prinsolo, and also tablet starting from 60 milligram. Now
Okay.
tapered to 5 milligram now.
Okay.
This
So,
all not working, and my kidney is suddenly going to fail. Now my criterion is 9.23.
it has increased drastically now. And
Yeah,
creatinine
drastically
9.
increased.
Mm-hmm.
During I am taking cyclophosphamide and rituximab. Somehow it is stopped around 4.5, 4.6, and the doctor, as the end judge suggested, all this medication is not working,
Not
so
working.
you have to stop it. And after I stop, the creatinine also increased. Now it reached to 9.3. I'm
Actually,
waiting for
creatinine.
dialysis symptom
Okay.
currently.
Actual में the currently creatinine is very high. है ना? So it
Yes,
means the both of the kidneys are functioning less than 15% already. So it is a
yes,
good
yeah.
thing that you are not having those uremic symptoms which require immediate dialysis. है ना?
Yes,
First thing,
yes.
I need to see the biopsy report. This is the first thing. Second
Yeah,
thing,
okay.
MPGN per se is not primary. It may be because of some other cause too. है ना? So the MPGN usually is secondary to some disease. So if we treat the
Yeah,
primary disease, then we can also control the symptoms of MPGN. ठीक है?
okay.
And now over the 6 months, it has not responded to any treatment because we have not been able to address the primary cause of MPGN. So in
Okay.
90% of cases, it is secondary to some other disease. And in 10% of cases, it is idiopathic. So without seeing biopsy report, is it difficult for me to tell whether what was the stage of the MPGN at which you were detected? First thing. Second thing, whether it was the primary or it was secondary. है ना? And the third thing, the treatment which has been given to you, whether it has been adequate or not. है ना? I also need to see the current reports, है ना? Both the blood reports and urine reports, है ना? And there are some set of investigations that I will like to get it done to rule out any other cause for the derangement of the creatinine and why you are not responding to the treatment. ठीक है?
Mm.
So
I
right.
shared already those documents. I shared on the group, this Hindu healer group.
Okay. You have already
I
shared.
shared already. I already shared, but they did not share you, I think.
हाँ.
So
So
they have to share you.
okay.
The primary causes like infection, all are checked, and it is unlikely.
Okay.
Like hepatitis
Oh,
B, hepatitis C, HIV,
yeah.
blood occult also checked. All are negative. So it is
Okay.
unlikely.
Okay.
It's difficult to know the main cause of the disease.
Yeah.
And maybe you have to check and
Hmm.
tell me maybe
नहीं, definitely. I
if
will.
you find it.
I will. Yeah. I will go through
Mm.
those reports which you have submitted to the Indus Healer, and they will be sharing. They will be scheduling an appointment and an online appointment with me, है ना, at a later date, so that we can discuss the further line of treatment. है ना?
Yeah.
So they will share the date and time plus my number with you, है ना? And we
Mm.
can plan an online appointment for the same. So in that we can discuss what should be our further line of treatment once I go through those reports.
Okay.
So for now, if there's a swelling and excess, if there's an excess of swelling, I will advise you to restrict your salt intake, to keep the fluid intake to less than 1.5 liters. है ना? And for now, just take the symptomatic treatment, and then in next online appointment, we can discuss what further treatment we can do for it, or whether we can avoid the dialysis at this stage or not.
Okay. How can I get you
Indus
number?
Healer. Indus Healer will connect with you, है ना?
Okay.
So
Okay.
they will
Okay.
connect with you and they will schedule an appointment with me.
Okay. Thank you.
Yeah.
Thank you very much.
Okay.
I think we have 2-3 more guests.
Definitely. We'll connect with them.
Good evening, sir. Good afternoon, doctor.
Hello. I'm Dr. Tarun.
Hello.
Hello. I'm Dr. Tarun. I'm from Sir Ganga Ram Hospital, India. है ना? So you can share your query regarding the renal disease with me. So what kind of kidney problem you are having?
By it is called bilateral renal bilateral parenchymal disease grade 1.
Okay, so you got a renal parenchymal disease. Huh?
Yes,
Acha. And
bilateral
what?
renal parenchymal disease.
Okay, so for how many days you are having the symptoms? Since when you are having the disease?
No, I just got admitted suddenly and I was diagnosed with it.
Okay. So when you got admitted outside?
That's like since December 2025.
Okay, December. What kind of problem you were having? What symptoms you had? I guess there is some problem with your connection. It got disconnected. So Nabo Tenje, can you please share your screen And can you unmute yourself? So till then, I will tell you about the facilities that we have at Sir Ganga Ram Hospital. So currently, oh, he's a, yeah,
Hello,
just tell me
doctor.
what symptoms you had in December, why you were admitted in hospital, what problems you were facing.
I difficulty in breathing. It's very difficult for me to breathe. So I was admitted to hospital.
Hmm. So, how was your BP at that time? How was your urine output, your BP?
I did some tests, then my BP was around 160. Then my urine has
160.
protein. Yes,
Acha,
then my
your
urine has
urine
protein.
had protein. Okay, and on ultrasound, were your kidneys normal sized or they were shrunken?
They were normal size, but they are
Normal
raised.
size
Yeah,
kidney.
they are, yes,
Okay. Okay, so you underwent the biopsy there? Biopsy was done?
yes.
Kidney
I did
biopsy?
several. I don't know the meaning of that.
Okay. Okay. So, what kind of medications were given to you?
I was administered for different injections
Okay.
into drip.
Okay.
I was given drip.
Okay. So, right now, your
I spent
creatinine is what is the value of your current creatinine?
Anything. I don't know. My doctor said he will give me that, but not yet, because I don't know how to calculate it myself.
No, no, you must have got the investigations done currently, na? So, how's the investigations now? How is your hemoglobin, your creatinine?
After the treatment, I was anemic,
Okay.
so
Okay.
I was administered blood tonics and some drugs to get back
Hmm.
to normal.
Hmm. So, what is your good name?
My name,
Yeah, your name.
yeah, Abibla.
Abibla.
Yes,
Can you share those discharge papers with us? The discharge papers
yes,
that you got.
yeah. I will share it. Where should I share it?
You should share it on Indus Healers, the same platform through which you contacted me, na? The
Okay,
people
on
who are
WhatsApp.
arranging this video call. Yeah, on WhatsApp.
I will I
Just
will
yeah,
send
yeah.
it.
Just share those papers with us, and that maybe once I will go through those papers and we'll connect again on video call
Okay, okay.
through another appointment.
Uh,
And so I will go through those papers once, and then maybe I can advise you about the medications which are to be taken to reduce the protein in urine to control your BP. And I will also go
yes.
through your ultrasound. Then we can plan the
Okay.
treatment accordingly.
Okay, okay. Since when I was treated,
Mm-hmm.
my BP is back to 120 something. It's back to normal.
Okay,
My BP is normal.
that's
Then
good.
sometimes you say I drink a lot of water now. I take a lot of water.
That's good. You should drink lot of water. You should avoid
So
any painkillers, protein supplementations, any
yes,
over-the-counter medications, homeopathic treatment. These all things are should be avoided.
yes. The more I drink water, the more I pee.
Yeah, yeah, yeah. So if you are not having any swelling, you should drink at least 2 liters of water per day.
Yeah, I do that every day. I don't have any swelling.
Yeah, yeah. Then just drink 2 liters of water per day.
Okay. I just want to know what type of foods
Hmm.
I should avoid because I take less salt now. I don't take sugar and salt anymore.
Yeah, yeah,
They are
yeah.
less.
You should avoid oily foods, packaged foods. You should avoid salt in your diet. These all precautions
Okay,
you have to take. If the potassium is high, then you should avoid green leafy vegetables, citrus fruits, and coconut water. That's
okay.
what you should.
I take lemon water and garlic too. Is it preferable?
Which water?
I take lemon water.
Lemon water. If your potassium is normal, then you can take the lemon water.
Okay. And I eat garlic too. Garlic.
Yeah, yeah, yeah. If your potassium is normal, you can take garlic even.
Okay. I will send you those results.
Yes.
Okay. Is that all for now?
Yeah. Just share your
But
report. Uh,
I have a question. for you.
Yeah. Just ask.
This grade one that I have it at a very young age. Can I manage it over years so that it will not progress?
Yeah, we have to start the treatment for the same, so it should not progress. That's why I'm asking. Just share all the reports and the discharge paper you have, and then maybe we can connect on the video call again for an online
Okay, I will.
consultation again. Yeah.
Okay, I will
So,
send you. Thank you.
yeah.
Thank you
Okay.
so much, doctor.
Okay. Take care.
Thank you. Bye then.
Okay. Bye.
Okay.
So,
Nabooth NJ, can you please unmute yourself one more time? And we have Dr. Tarun Kumar with us from Sir Ganga Ram
yeah,
Hospital.
just unmuted himself. And can we have the
Oh,
video too?
thank you for having.
Good
Yes,
afternoon.
there's a problem with my front camera.
Okay. It's okay. I can listen to you. You can just ask your query.
Yes.
Hmm.
Some time ago, I had some complication and I went to the hospital. And after examination, the doctor prescribed some medication for me, about three, Prexap, Imbacos, and Tenoxicam. Those are medical terms I'm not familiar with. And before he put me on medication, he said that there is impurity in my kidney, that I need to take these medications I mentioned. That I should
Okay.
also take much water. I've been doing this for quite some time now, about 6 months ago. I've been doing this for 6 months now. Yet the improvement is minimal. So I want to
Okay.
hear from you what other uh, medication would you recommend, or what other medical procedure will you recommend for me to be on?
So, what exact problem you were having related to the kidney? Why you started taking medications and why you went to the doctor? What symptoms you were having at that time?
Yes, I used to experience pain by the left side of my abdomen, and also
Okay.
a mild,
So,
a mild, a mild back pain.
yeah.
Yes. So when I went,
Okay.
he did some examination in one of the laboratories, and he said
Okay.
there are impurities in the kidney, but he said there's no kidney stone.
Acha, there was no kidney stone, just the pain you were having, है ना? And were you all also having any burning micturition? The pain was radiating
Pardon?
towards the thighs while micturating. Any fever, any abdominal pain, any vomiting that you're having at that time?
As at that time, there was no any of the things you mentioned. However,
Hmm.
I used to sometimes lose my appetite, and I I also tend to not feel so well. Like I feel sometimes as if I'm feverish.
Okay.
Those are tunnel, yes. But for this period of 3 months that I've been on the medication, the fever I used to experience has kind of has gone away, but there's pain in on the left side of the abdomen is still there. Though
Okay.
it is
So
mild,
what? Yeah.
though
So
it is
what we
mild,
can do? What we can do, I can go through your reports. The investigations that you have got done so far, I can go through those reports. I can review your treatment, and then maybe we can figure out why you are still having fever, why you are still having pain, and why the kidney functions are not improving. So I will ask you to share all these reports, all the medications, the prescription that you are taking with Indus Healer, so that I can go through them, and then we can plan another video call appointment for the same to discuss
yes,
the
that will
further
be good.
treatment that needs to be done.
Yes, that will be good. Currently, I'm
Yeah.
not there
Yeah.
because I'm attending program and we're
Yeah.
on
Yeah.
break. That's why I have this opportunity to be on the
Yeah.
conference call. So when
Yeah.
I get back,
Yeah.
since
Yeah.
I have I have one of, should I say, the people over there with you. I have one of their contacts.
Okay,
It was
okay.
through them I was able to get
Yeah,
connected to this conference
yeah, yeah,
call.
yeah. Definitely. So we can do the same. So just share all the reports and investigations and all the discharge paper and medications you are taking with Indus Healer, and then we'll plan a video call appointment again accordingly. Okay?
That's all right. That's all
Oh,
right.
okay. Okay. Take care.
Thank you so much.
Okay. Thank you. Yeah, Ibrahim. I'm Dr. Tarun Kumar. You can ask me your query related to kidneys. I guess the network is not that good. Maybe we can take another caller.
So we have other guests as well. We
Yeah,
have
yeah,
just
sure.
Kaur.
Yeah, yeah.
You can unmute yourself and you can ask your query, ma'am. So
Yeah.
we have Dr. Tarun Kumar with us from Sir Ganga Ram Hospital. Whoever is under the name Vivo V2138, we can see you. Can you please unmute yourself so that you can ask your question to Sir? Sir, please unmute. Okay.
Hello, good evening, sir.
Good evening. Good evening.
Myself Rakesh Shah from Nepal.
Okay, okay. So in which language you are comfortable with? English or Hindi?
Hindi and English, maybe anything, sir. Hindi or English.
Okay, okay, okay. I'm
हिंदी हिंदी
डॉक्टर
भी चलेगा सर, हिंदी भी चलेगा सर.
चलो ठीक है, मैं डॉक्टर तरुण हूँ, गंगाराम हॉस्पिटल से किडनी स्पेशलिस्ट। तो आप मेरे को बताओ किडनी से रिलेटेड क्या इशू है।
सर मैं लास्ट 1.5 साल से मैं शुगर पेशेंट था.
ठीक है।
एंड मैं काठमांडू, यहाँ नेपाल काठमांडू में डॉक्टर नॉर्विक में दिखाता था, नॉर्विक इंटरनेशनल हॉस्पिटल में.
हाँ, हाँ।
तो वहाँ पे जब मुझे पता चला कि आई हैव अ शुगर, देन उन्होंने मुझे कुछ टेस्ट वगैरह कराया. तो उस टेस्ट में मुझे यूरिन में प्रोटीन लीकेज बताया. तो उन्होंने मुझे सीकेडी, क्रोनिक किडनी डिजीज करके ऐसे कुछ लिख के दिया.
टेस्ट कराए फिर?
टेस्ट के बाद मुझे उन्होंने सीकेडी और कुछ मेडिसिन वगैरह दिया. लगभग एक साल जितना मैंने मेडिसिन वगैरह खाया, लेकिन मुझे उससे कुछ इम्प्रूवमेंट नहीं रहा. 1 साल में लीकेज वो जो था वो
चलता रहा।
कंटिन्यूस, हाँ, चल ही रहा था.
अब भी
तो
हाँ
फिर
फिर?
उसके बाद फिर मैंने प्लान किया दिल्ली के लिए. एंड दिल्ली में मैंने फोर्टिस में दिखाया.
ठीक है।
फोर्टिस में दिखाने के बाद वहाँ पे भी मुझे कुछ मेडिसिन वगैरह ऐड किया था. एक टेलमी साटन करके एक मेडिसिन है, 80 mg.
ठीक है।
तो टेलमी साटन 80 mg मैं अभी खा रहा हूँ.
हाँ
एंड
जी।
रेस्ट अभी लास्ट टाइम जब मैंने 3 महीने पहले, जब मैं 2 महीने पहले मैं दिल्ली फिर से फॉलोअप पे गया था. तो
हम्म।
उन्होंने फिर मुझे बताया कि पहले से आपका जो यूरिन में जो प्रोटीन लीकेज है वो अभी बंद है करके.
ठीक है।
तो इस समरी सर अभी इतना है सर. तो आगे कैसे क्या होगा, क्या रहेगा?
कुछ नहीं, पहले तो हमको फिगर आउट करना पड़ेगा क्योंकि शुगर का हिस्ट्री जो है ना वो सिर्फ 1.5 साल का ही है। यूजुअली हम एक्सपेक्ट नहीं कर सकते हैं कि 1.5 साल के शुगर में ही किडनी के अंदर यूरिन में प्रोटीन आने लग जाए। ठीक है। तो सबसे पहले तो यही देखना पड़ेगा जो यूरिन में प्रोटीन आ रहा है वो शुगर की वजह से ही या कोई और कारण है। आंखों का भी चेकअप हुआ है क्या आपका?
जी सर, मैंने रेटिना का भी टेस्ट कराया था.
हाँ,
तो मुझे
उसमें क्या है?
रेटिना में ऐसा कुछ नहीं है सर, कोई इश्यू नहीं है.
ओके, ओके, ओके। तो फिर तो ये एक और स्ट्रॉन्ग रीजन है देखने के लिए कि ये जो यूरिन में प्रोटीन आ रहा है शुगर की वजह से ही या कोई और कारण है। पहली चीज ये हो गई। दूसरी है, टेल्मा दवाई तो उन्होंने ठीक शुरू किया है, पर हमारे पास और भी मेडिकेशन हैं जिनसे हम यूरिन में प्रोटीन कम कर सकते हैं। ठीक है। तो यूरिन में प्रोटीन कम करके हम डिजीज के प्रोग्रेशन को भी कम कर सकते हैं। अभी कितना है क्रिएटिनिन आपका?
क्रेटनिन अभी सर मुझे देखना पड़ेगा एक बार. मैं अभी आपको देख के भी बता सकता हूँ.
हाँ।
क्रेटनिन क्रेटनिन तो मेरा नॉर्मल ही था. अभी जो पहले था वो रेंज में ही था, नॉर्मल ही था.
ओके।
तो मैं सारा रिपोर्ट्स वगैरह सर, मुझे अगर आप बोलोगे तो मैं आपको शेयर भी कर देता हूँ.
हाँ, बिल्कुल बिल्कुल, ये इंडस हीलर्स है ना? ये सारे रिपोर्ट्स आप इनको शेयर कर सकते हैं। और ना फिर ये इनसे बात करके हम ना एक और वीडियो कॉल अपॉइंटमेंट फिर शेड्यूल कर लेंगे, ठीक है, फर्दर क्वेरीज
बिल्कुल
के लिए। और उसमें हम फिर
बिल्कुल
डिसाइड कर सकते हैं कि आगे का ट्रीटमेंट हमें कैसे कंटिन्यू करना है, ठीक है।
बिल्कुल सर, बिल्कुल बिल्कुल
है ना?
बिल्कुल बिल्कुल।
तो
हेलो सर।
ठीक है फिर, मैं इनको बोलूंगा एक बार आपसे कांटेक्ट करेंगे, है ना। और फिर हम एक और अपॉइंटमेंट शेड्यूल कर लेते हैं, आप रिपोर्ट सारी मेरे को शेयर कर देना। और फिर हम पहले वीडियो कॉल पर ही सब कुछ डिस्कस करेंगे, फिर देखेंगे अगर ज़रूरत होगी, अगर आपको आने की ज़रूरत लगेगी तो फिर मैं बुला लूंगा, है ना। आपकी
हेलो
आवाज़
सर।
नहीं आ रही। हाँ, आपकी आवाज़ नहीं आ रही।
सर उन्होंने मुझे जब मैं नेपाल में दिखा रहा था
हाँ हाँ
किडनी के डॉक्टर से, तो उन्होंने मुझे सजेस्ट किया था बायोप्सी के लिए।
हाँ, वही।
तो
पर पहले पहले ना मेरे को एक बार आपकी रिपोर्ट्स रिव्यू करने दो, फिर मैं डिस्कस करूंगा इसके बारे में भी, है ना। तो अभी तक जो भी ट्रीटमेंट चला है, जो भी लेटेस्ट प्रिस्क्रिप्शन है, फर्स्ट प्रिस्क्रिप्शन है, वो आप शेयर कर देना। मैं पहले वो देख लूंगा, फिर हम इसके बारे में डिस्कस करेंगे।
तो मैं जो ये सारा रिपोर्ट्स आपको शेयर करूंगा, जो बिल्कुल स्टार्टिंग से सर।
बिल्कुल बिल्कुल, जो इनिशियल का है और जो करंट ट्रीटमेंट आपका चल रहा है और जो इन्वेस्टिगेशन अभी तक हुई है, वो सब कुछ शेयर करना है।
बिल्कुल सर, बिल्कुल बिल्कुल मैं शेयर करता हूँ सर।
ओके।
अगर आप मुझे जैसे भी बोलोगे, अगर मुझे आना पड़ेगा तो मैं आ
हाँ जी
सकता
हाँ
हूँ, यहाँ
जी,
से कोई इश्यू नहीं है सर।
डेफिनेटली। ओके जी। ओके।
थैंक यू सर, थैंक यू वेरी मच।
ओके, आपका नाम क्या है?
मेरा नाम राकेश शाह।
राकेश साहब, ठीक है।
हाँ,
थैंक यू। ओके।
थैंक यू सर, थैंक यू,
हाँ
ओके।
हाँ।
We have another query from, I think, Maman Bature. Sir, can you please CCIT tab S9 Ultra? Can you please unmute yourself?
या
Okay, you're from Nigeria. Got it. So you can raise your query, and we also have Stanley Jaika.
या
Um, so if you can just raise your query, you can unmute yourself and you can raise your questions here.
स्टैनली, कैन यू रेज योर क्वेरी? गलमो आना,
Hello sir. Good afternoon.
गुड आफ्टरनून। यस,
How is your work?
आई एम डॉक्टर तरुण,
Uh,
I am from New Delhi, India, from Sir Ganga Ram Hospital. I am a kidney specialist. So you can tell me what problem you are having regarding kidneys, what you want to ask.
okay sir. I am Mama Bature from
Hmm.
Yobe State, Nigeria. I need you to
Okay, okay.
explain more this about this problem with kidney, and also I need you to prescribe me the main drugs that I use to treat the kidney problem. Yes.
Okay. Okay. So what kind of medication you are using currently now?
Uh, I cannot use it with any kind of doctor. I need you now to prescribe me the main drugs that I use to treat the problem of the kidney.
What kind of problem you were having with kidney? What kind of problem you had?
The problem is that the sometimes the patient BP cannot down. Always the BP is high, and also he has the problem of calcium problem.
Okay, okay, okay. So since how many days you are having these problems?
So I think the thing is more than 6 months.
6 months. So you also are having problem with urine? Any problem with urine? Any difficulty in passing urine? Any pain during maturation? Any blood in urine? Any frothiness in urine? So what we can do, you can just share your reports and the medications you are currently taking with Indus Healer, and maybe we can plan another video call appointment to discuss your problem. Will that be fine?
Sir, yes, sir. Okay.
Okay, sir.
Yeah,
Okay, sir.
yeah. So,
I have seen you even on
okay,
WhatsApp so that we can chat
okay.
about. I can send you the old report and the cases that we do before.
Yeah, yeah. Definitely. We'll plan treatment for you accordingly. Okay,
Thank you. Thank you.
okay. Thank you. Stanley.
Hello,
Yes, hello.
are you
I'm
getting
Dr. Sir. Yeah, just tell me.
are you getting me? Okay, are you getting me?
Yeah, I'm getting you. Just tell me.
So I'm calling from Kenya.
Okay, sir.
I had a kidney complications from May last year.
Yeah,
Currently, I'm undergoing dialysis and at St. Mary's Hospital in Kenya.
okay.
So my question was, how long can one stay on dialysis
Yeah,
before considering maybe transplant? And then what factors or what may be leading to the increase in creatinine? Because it has
okay.
behaving abnormally, it drops, it increases. So I have two queries. I need your answers.
Yeah. So
Yes.
if you are having uremic symptoms, so why you were started on dialysis? Because your creatinine was high, plus you were having uremic symptoms like decreased urine output, swelling in the body, shortness of breath, vomiting. Because of all
Yeah,
these
yeah,
things,
yeah.
yeah, your
Mhm.
dialysis was started. So what
Yeah.
access you are having for dialysis right now, whether it is a fistula or you are having a catheter?
At first, I started with the catheter,
Okay.
but early this year,
Hmm.
January, I started using the fistula. My fistula was ready. I've started using the fistula. In fact, the catheter was a temporary one. It has been
Oh,
removed. So I'm using the fistula. But
yeah.
the
So,
catheter was misbehaving.
yeah.
The creatinine could drop at some point. It could increase. So I don't know why is it happening that way.
Yeah. So the thing is, currently your
Mm.
kidneys are not working. And that's why
Yeah,
the creatinine is
yeah. Mm.
increasing. So the
Mhm,
dialysis is like an artificial kidney. It does
mhm,
the work for your kidney, the work that
mhm,
kidney is not able to do right now because of the illness
mhm,
and disease. So the dialysis
mhm,
machine is doing the same. So it takes out all
mhm,
the toxins from your body, है ना? It takes out the excess of the
mhm,
fluid from your body, है ना? And it
mhm,
decreases
mhm,
the workload of kidney. So
mhm,
whenever you get the dialysis done, the creatinine is kind of a toxin only. It is called uremic toxin, है ना? So that
okay.
increases
Mhm,
because of the defect in kidney, because the kidney is not able to function properly. So whenever you do the dialysis, so those toxins are removed from the body. Hence, there is a fall of creatinine. And when you delay it for like a day or 2 or 3 or 4 days, then again this toxin build up in the body. So that's why
mhm,
again you have increase of creatinine. So that shows that your kidneys are not working. First thing, that's why you have increase of creatinine. Now, the second
mhm,
thing, you are having the dialysis being done with an AV fistula. So the access is quite good. If the fistula persists, there are no complications with the fistula, then you can even stay on dialysis. है ना?
mhm.
So what is your age? Age right now?
I'm 44 right now.
44. So you are quite young. है ना? You are quite
Mm,
young. 44 is quite
mm,
a young age. So at
mm,
this
mm,
age, I will prefer, I will suggest that you should go under the transplant. Why I'm saying? Because the
mm,
quality of life is bit better on the transplant. That is the
mm,
thing. Second thing, you can stay as long as you want on dialysis if your vascular access is quite working perfectly. If you are having a good
mm,
functioning fistula, then you can stay on dialysis as long as you want, because you already said yourself that the catheter was misbehaving. So the catheter can misbehave. So if the fistula is working perfectly, you can stay on dialysis as long as you want. And and a broader term, if you will ask me, if there
mm,
is a life expectancy of 5 years on dialysis, it is like 10
mm,
years on transplant. So at a younger age, As compared to the comorbidities, transplant is always better than dialysis. But if you are having a well-functioning AV fistula, you don't have any problem with the vascular access, then you can continue on dialysis as long as you want.
Okay, about the transplant.
Yeah.
There have been some concern about the transplant, which I want just to you to clarify.
Yeah.
If someone could prefer the transplant, is there a way that it may be unsuccessful, and what causes? And why?
Definitely. See, first we do extensive investigations, both of the donor and recipient. So we may have a successful renal transplant. In spite of doing all these investigations, there are some chances that the transplant may fail. है ना? So in case of a live related donor, if you are having a family member who is donating to you and he's a live donor, then in about out of 100, 99 transplant are successful. Only one transplant may have any problem which may be because of any rejection, infection, or drug toxicity, and in later stages maybe because of the cancer. So the causes for the transplant failure broadly are because of the rejection, because of the infection, because of the drug toxicity, and later on maybe because of the cancer. So these are the main causes. Then the other causes could be because the surgery was not being done properly. And so if we are having any difficulties during the surgery, then it may also lead to failure of transplant. So, but the rate of transplant is very good. So if it is a live related donor, then about 99% transplant are successful. So that is quite a good rate.
And in case of unsuccessful transplant, what happens to this patient?
If it is an unsuccessful transplant and the transplant is quite salvageable, the kidney is salvageable, first we try to salvage the patient and the kidney. So that's what we do. So it's not always कि after the transplant failure, the patient may lose, we may lose the patient, we may lose the kidney, because in most of the times it is salvageable if the treatment is started within time. So yeah. So we can salvage the kidney in most of the cases.
Okay, thank you.
But the treatment should be prompt. Yeah, thank you. Okay, so I guess we are done with all the callers right now, है ना? So I guess we have answered all the queries that our international patients have, and I hope I was able to answer them correctly, and they must have been satisfied with all the answers that have given to them. And for further questions, I will ask them to contact Indus Healer so that we can connect again to clear the queries that still are there. And maybe we can plan the next session next week on Friday after 6:30 p.m. Indian time. And there we can specifically discuss about the transplant and the outcomes of the transplant and the problems that we can face and what other options we can have if we are not going for the transplant. So with this, I will like to close this session. Thank you.